Shankar and Nadia. We are live. Well, actually, for some of you, it might be good morning still. For others, afternoon, evening, who knows? We have people from all over the world tuning in. So definitely, if you are with us in your chat, in the comments, type in, we are here, I am here. And if you want to, tell us where you're from. Nadia, how are you today?
I am awesome. I am excited to be here. This is my first live, and I would not want to do it with anybody else. So,
Fantastic.
I'm
Yeah, I know.
excited to be here.
People are always nervous about this, but it's really just having a conversation and
Exactly.
sharing some good information. And
Yep.
you and I, we both care about the healthcare field. Personally, I own a healthcare marketing agency, but also I'm an advocate for free market medicine. And then, of course, you have a whole set of knowledge and activities in the healthcare space, and that is why both you and I are really good candidates to talk about the healthcare landscape in the United States. So, Nadia Boutaoui, you're the founder and CEO of NanoNeris, a startup developing organ-on-chips tools for preclinical testing of respiratory diseases drugs. Wow. Do you want to, that is very impressive. Do you want to elaborate a little bit on that?
Yeah, absolutely. So, my background, I was doing research running a genetics lab at Children's Hospital of Pittsburgh, working with world-class pulmonologists and researchers. We had a lot of high-impact papers in the field, yet two of my kids had asthma, and I've seen firsthand how it's managed and the lack of drugs that are available to these world-class pulmonologists. So the scientist in me wanted to look into why is that. So we found out that there is a very high failure rate of drugs in clinical stages. And that could be true partly because of the existing preclinical methods. There are two parts. They are either simplified cell cultures from human, but it does not represent the complexity of the system, or animals that represent the complexity of the system, but it's not a human model. So I looked into what if we can bridge that gap so the data will be more translatable into the clinical stage. So that's where the organ on chips come in. There are existing organ on chips for the lung and different organs, and we wanted to develop something with easily accessible cells. And that's where NanoNeris, which is nano for small, Neris for the nose, to develop organ on chips using cells from the nose. And they could complement existing methods to improve the chances of success in clinical trials.
Yeah, wow, that to me, quite frankly, Nadia, sounds like science fiction almost. But
It's fun.
nanotechnology, yeah. So it goes without saying that you have a pretty extensive understanding of technology and how that translates to healthcare, right? I mean, obviously, you have to.
Exactly. Yeah. I think that my background in the research side and then seeing that moving that technology to market, there's like almost a gap that needs a bridge. And I decided that, oh, I need to educate myself about how to move technology to the market. So while being a faculty at Pitt, I pursued a tech innovation and entrepreneurship certification at the CAT Grad School of Business. I felt I was barely scratching the surface, so kind of jumped in the deep end and pursued an executive MBA in healthcare with focus on technology, innovation, and entrepreneurship. So part of what I do as well is to develop hands-on workshops to help startups validate their ideas, products, or services before to increase their chances of success at launch. And this is done through hands-on customer discovery. I learned the hard way that it takes a long time, and time is the most precious thing we have, especially for startups. So if we can package that in like a 6-week program where they will be immersed into talking to their not only customers but different stakeholders to
Mm.
gain a good picture of the ecosystem to what the actual problem is, and then they can go back to the drawing board, whether it's their minimal viable product or service or value proposition analysis to adjust their offering to the actual problem being experienced.
Wow, yeah. And I mean, it is going to be hard to find a person that has that knowledge combined. And
Mhm.
you are such a person, and people can just go to your LinkedIn profile and reach out to you.
Mhm.
You have a non-binding 30-minute chat that you will have with everyone. So definitely take advantage of that. I think that's very fascinating. Actually, not too long ago, I was talking to a good friend of mine who's a professor here at UIW in San Antonio and does research in medical tourism. And we were both thinking about, well, if we were to create a blog about medicine, what are some hot topics? And
Mhm.
as an expert in search engine optimization, my mind goes to keyword research, right? See what trends are there, and what are people in the healthcare space looking for.
Mhm.
What was at the top was definitely new technologies in healthcare. It is a
Absolutely.
space that has so much
Mhm.
potential, and I'm sure.
Hello. Oh, can you hear me? Uh, I'm not sure if you can hear me, Shankar. Hello.
Whoops, there.
There you
Okay, we
go.
are back for a moment.
We're back.
There are
Awesome.
supercomputers
Mhm.
that you can feed symptoms to it, and then the computer makes a diagnosis for you, and it's often almost more accurate than the
Yeah,
kind of.
IBM. Yeah, IBM Watson Healthcare is a leader in that space, and it's interesting you mentioned that because they've announced last Friday that they're going to sell their healthcare uh, arm to their partners so they can focus on using AI for the predictions rather than the delivery. Because once you predict something, the implementation is a whole different ball game. So they wanted to focus on the logistical side and pass on that implementation to other healthcare providers. But
So,
you also mentioned the innovation, especially in the past 2 years. So typically, innovation thrives whenever there is like a seismic shock. And we've experienced that seismic shock through the pandemic. So there were
mm,
so many innovation both for making the vaccines, and we've seen that with the mRNA vaccines. For even in the supply chain itself, we've seen major changes to shorten the supply chain and to move it from offshore to onshore supply chains. This will increase the agility of companies. There's also testing, the remote, for example, for remote working. We've seen a lot of solutions in that space too.
mhm. Yeah, I mean, we did want to mention too that people who watch this live, they can definitely leave questions in the comment section as well. We will get to
Mhm.
those towards the end,
Yeah.
but we will make sure we address that.
Hmm.
It's of course. Honestly, I wish we could have had this talk here today without mentioning the pandemic, but it is
Hmm.
clearly not possible, right? We have to talk about that, and it kind of is connected to something that you and I wanted to have a focus on today, which
Hmm.
is disparities of access to healthcare. Um,
Hmm.
during this time, but also pre-pandemic. So I
Yeah.
know that is something that is very dear to your heart, and you have actually conducted quite some research on that. So,
Mhm.
what are your thoughts on that, Nadia?
Yeah, I think the healthcare disparities, just so that we are clear with the audience what we mean by that,
Yeah.
it's that it refers to differences between groups in health insurance coverage, in use, in access and use, as well as the quality of care. And that existed. We know that underserved groups and people of color. And this is relevant because we are at the beginning of February, which is the Black History Month, that we need to talk about those differences. That those disparities include infant mortality, pregnancy related health and deaths, prevalence of chronic conditions, the overall physical and mental health. And mental health is like the elephant in the room that is not talked about, that was even more pronounced during the past 2 years. Those disparities that resulted in differences in life expectancy. For example, Black people, their life expectancy is 4 years lower than white people. And that's in 2018. In 2020, that number plunged by another 18 months. So the expectancy for Black and Hispanic American was reduced by 18 months. That's the steepest drop since World War II. So within 2 years, less than 2 years, the expectancy dropped by a year and a half. And this is why it's important to talk about those differences. We know that those disparities are driven by social and economic inequities. Those inequities are like economic stability, such as employment, income, expenses, and debt. The neighborhood or the physical environment that includes housing, transportation, access to parks and playgrounds, the walkability of the neighborhood. There's also the education, the literacy, access to higher education and vocational training, access to nutritious food. So the food security, there's some places that are called food deserts because there is no market where you can get fresh fruits and vegetables at an affordable price. There's also the community and the safety and this in a social context, and that includes integration, community engagement, stress. And that we've seen that was even more pronounced with the isolation measures and loss of jobs. So that stress skyrocketed over the past 2 years. And the last but not least is the healthcare system itself. You know, the healthcare coverage, the availability and the cost of the healthcare access, um, as well as, and that's especially important for rural areas that have way less access to uh, not only PCBs, but even more to specialists. Um, so I think this is why, and we've seen that with the pandemic, all of those numbers got even worse, especially the chances of excess death per 100,000 people in Hispanics and Black people is 3 times more than for a white or an Asian person. That's
Mm.
3 times more. If you are of that ethnic group or that subgroups and you are within the pandemic, you are 3 times more likely per 100,000 to die as compared to an Asian or white person. And that disparity is even more pronounced even with vaccinations. The vaccination gap between Black Hispanic people are 29%, and it's all the way up to 50%. So there is a 20 percentage point difference between two different groups. Um, why is this important? Because that disparity costs money, a lot of money. The estimate that this disparity amount to approximately $93 billion in excess medical care. That's on top of what they already provide. That's extra. And $42 billion in loss of productivity per year. Not only that, if we don't address that now, it would only get worse because at present, people of color and minorities are 39% of the US population. And by 2050, it's going to go up to 52%. So if we don't address that, it's going to cost even more in the future to provide care um, as an intervention as compared to a prevention measure.
Mhm.
Yeah,
Well, yeah. I mean, I think it really starts with having awareness that there are those differences, and especially when you think about right now being a Black History Month, it's really important to bring those things up. And
yeah,
uh, one thing that you said is the elephant in the room is the mental health aspect.
hmm
So why, I think a lot of people would ask themselves, well, why is mental health so important? Why is access to mental health so important to people?
hmm I think, especially in certain cultures, like there's stigma associated with mental health. And I will look back, for example, for African American men, you're not supposed to talk about that because it, it's a sign of weakness in a way. So
Mm,
they are from early on, they are discouraged from talking about it. And this pressure, and that's across all different population, was even exacerbated with the social isolation during the past 2 years because we are social being. We like to, to socialize and to get with our community, with our friends, with our family. On top of that, you add the loss of jobs and lack of access to childcare. That put even more pressures on caregivers,
mhm.
both of children and of the elderly or the sick. And and this is why I think we should definitely normalize talking about mental health issues as we talk about physical health issues.
Yeah, well, and it's actually a very, very current topic because if I am not mistaken, yesterday or 2 days ago,
hmm
Miss USA, who was a Black woman,
Yeah.
committed suicide,
hmm
very likely because of mental health issues, because from
hmm
the outside, everything was perfect or seemed perfect.
Yeah, yeah, yeah.
Yeah.
And we've seen, for example, a lot of Olympians, for example, that had to withdraw from certain high visibility events because of their mental health. And there was a lot of media uproar that, oh, why should they? But it's important. I think they had a lot of courage to do that.
Mhm. Yeah, and something else that I also want to bring up that I learned by I'm actually in a relationship with a Black woman, and I learned so much. She told
hmm
me, for example, that in the medical realm, it
hmm
was thought in the past that
Yeah,
black women have a higher tolerance for
for
pain, right?
pain. Yeah. hmm
Which is just crazy to think
Yeah.
that. And I think it's really important to
Yeah.
realize that that is, of course, not the case.
hmm
And yeah, the
Even
other, yeah,
yeah,
go ahead.
go ahead. Yeah, even in terms of how important it is to include different groups, even at the base level of research, is that when you develop your genetic or drug development or clinical trials, you need to include different population because genetically they respond differently to these drugs. The other important thing, and because we are at the beginning of the fourth industrial revolution, where AI plays a big role in predictions, is to make sure there's those biases don't make it into those algorithms. And you mentioned the example of the perception that if you're an African American, you have a higher tolerance for pain, and therefore you don't need uh, certain drugs that would have been otherwise being prescribed. That goes into even in the predictive models for decision making that uses artificial intelligence. To bypass that, there should always be a human element to verify those codes. And there are a lot of examples that showed that if not adjusted for early on and have some metrics to control that, it can easily get out of hand.
Mm. Yeah, I mean, you make a very good point about these predictive technologies because another thing that I was made aware of in dermatology, for example, is that for the longest time there
Mm-hmm.
was no education for doctors, for dermatologists to look for symptoms or signs in dark skin, right?
Mm-hmm.
And that is
Yeah.
something where, yeah, wow, it's you just never think about those things.
Yeah.
But actually, this morning I saw that a medical college, I forget which one it was, had
Mm-hmm.
a program out there that was specifically teaching that. So we do
Yeah.
see, of course, there's also a lot of hope, and we'll talk about hope today as well,
Mm-hmm.
specifically when it comes to having access to high quality and accessible healthcare.
Yeah.
Um, yeah, maybe we should take this opportunity to transition a little bit
Sure.
into the conversation about access
Mm-hmm.
and how insurance might play a
Yeah.
role in that. What are your thoughts on that, Nadia?
I think in addition to the social and the economic like inequities, I think healthcare coverage plays a role there too. Um, we can't talk about this without touching on the Affordable Care Act and expansion that led to large gain of coverage across groups, especially people of color and Hispanics. However, in 2017, the coverage gain they stalled and began to decline due to certain healthcare policies and immigration policies. And as a result, healthcare, um, especially in immigrant populations and Hispanics, dropped for fear of applying and participating in Medicaid and CHIP. I wanted to clarify Medicaid versus Medicare. The Medicaid is for people that are below a certain income level. Medicare is for older people above 65, and CHIP is for programs for children until the age of 18. So the uninsured rate ranges from 7% in white populations and Asians to 20% for Hispanics. So one out of five Hispanics is not covered by insurance, and 22% for American Indians and Alaskan Natives. So you can see that it's almost triple uh, of the population that is not covered.
Hmm.
And the insured rate is higher during the past 2 years. And that's due to job losses, because a lot of jobs that were lost were in the service and hospitality industries. And it's more likely that it's a minority person that would be working in those types of jobs. So they even suffered even more from insurance. Um, I also mentioned the immigration policies that discouraged a lot of people from using what they should be eligible for.
Yes. Well, um, I want to get to the part where I want to talk about the
Mm,
solutions that are out there as well, right?
sure.
But I also want to remind people, put your questions and comments into the chat. We'll get back to that later.
Mhm.
So, Nadia, have you ever heard of the principle of free market medicine and direct primary care? Is that a something that you've heard about?
Yes, I did hear about that as an alternative method for providers or group of providers that opt out of accepting existing insurance and go with their own in-network type. It's based on a monthly premium that is negotiated between them and the providers. And I
Absolutely.
and I think it's especially with so many uninsured people that are on the marketplace that are not, for some reason, they can't be in the Medicaid coverage, and they can't be in the ACA because it's probably costly for some other reasons. That could be a third alternative for them to get health coverage. But I know you're very interested in that, so I'd love to hear more about it.
Yeah, absolutely. So you're right. There's different approaches in the free market. The beauty about the free market, actually, let me bring up the website where you can get more information on that. But the beauty in the free market is that American ingenuity and the love for entrepreneurship can bring solutions that solve a problem. For instance, in most cases, quality access to affordable healthcare. And one solution is membership based medicine that can function in a way where you have a monthly membership fee that you pay to a clinic, or also a smaller, just maybe one, just a doctor. And then you have access to that person as often as you want, sometimes at no charge or just for a very small fee. The other way where free market principles can be applied to the healthcare industry is just by having a cash price. Just like with everything that we know on the marketplace, most everything, if you do your research, for instance, you want to know how much does it cost to fly to Paris next month, you can go on the internet and get a price in advance. And that is something that for the longest time, and actually still to this day, is not quite easy to find that out. So the free market advocates, if you will, try to solve that problem. And I was in that situation a few years ago when I was still freelancing. I have a team now, but I was freelancing and I paid, I think it was about $480 for myself per month. And it was, as most of you know, a high deductible insurance plan. And it was just not a good fit for me because I would never reach the high deductible because I was a relatively healthy person, nor was I interested in paying the copay. So I found at that time that here in San Antonio, there was a doctor that at that time said, hey, if you pay me $59 a month, you can become a member of my clinic, and then I will take care of your healthcare needs whenever you need it. You have a HIPAA compliant app, or you come into the clinic, and then I'll take care of you. Now, the question is, of course, well, how much does that cost, right? And in this case, for example, each time I saw him, it was just a $10 fee. And if I used the app, it was for free. He didn't charge anything to use the app. Now, the other thing is that people always ask, well, how much can you take care of with
this plan,
with,
yeah.
with this plan, right? And it just so happens that for your typical healthy American, relatively healthy American, 80% of a person's needs can be covered in such a clinic. And that is beautiful because now all of a sudden, because you don't have to deal with deductibles and copays, you can take care of your chronic ailments that you may have, such as diabetes, hypertension, and other things. Maybe you're overweight and you need a doctor to have a plan, set up a plan with you. And that's just something that was so beautiful for me to see. So I think I became his second member here in San Antonio. And I got so passionate about this that I actually co-founded the chapter of the San Antonio Free Market Medical Association with this doctor. His name is Dr. Roger Mochigemba. And it's been very, very empowering to see that in a free marketplace, there are different actors. There's buyers, sellers, vendors, and suppliers. And who are the actors? Well, the physicians. Of course, the buyers are the patients. Very often, the buyers are employers because most Americans,
Yeah.
as you stated earlier, get their health solution or their health insurance from their employer. And then there's pharmacies, There's, of course, the
So
insurance
you're
brokers. And
gonna answer my next question is gonna be like, how about the medication component? So you touched on the pharmacy.
yeah, there are actually solutions for that as well in the free market space. One
Mm-hmm.
that is very known throughout the nation is, of course, GoodRx.
Yes.
Everybody
Mm-hmm.
knows that
Yeah.
app where you can basically walk into a pharmacy, and
Mm-hmm.
if you happen to have the app, you show the code, then
Mm-hmm.
you get a better rate as if you purchased at the very same location your medication
Yeah.
without the app. Um,
Mm-hmm.
a local pharmacy that is also a membership based pharmacy is Scriptco, for example. I believe they in
Mm-hmm.
Waco, Texas. And you can have a membership with them,
Mm.
and just a similar concept. And then there's a whole bunch of medication that you get for a very affordable rate.
I
And
see.
yeah,
How about if you have like certain conditions that are not part of the 80% healthy American that could be covered by those offices? What are the options for the people to get
yeah,
extra
well,
coverage?
that is a good question. So there is a growing network of specialists
Mm-hmm.
that also decide to follow that trend. For example, I personally know of an oncologist in Austin.
Mm-hmm.
I know of a rheumatologist
Mm-hmm.
in, I think she is out of California, but has licenses to practice in many states. And I know of yeah, a person that works with people who have diabetes, and
Mm-hmm.
so there's a lot of specialists who become part of this trend to actually make healthcare and health accessible.
Mm-hmm.
And by becoming a member in the San Antonio Free Market Medical Association, you get access to that network. There
Yeah.
are actually you don't even have to be a member to go to shophealth.fmma.org, which is
Mm-hmm.
a page under the parent organization, where you have basically a search form and you can enter a procedure or
Mm-hmm.
a certain type of doctor that you're looking for, and you get prices in advance for that.
I
And
think price transparency is a big one
yeah,
because sometimes healthcare looks like a black box. You have no idea. You receive a bill later on, and then
yeah,
you don't
absolutely.
know how to break down that bill.
Speaking of technology, also, Nadia, there's a lot of apps coming up where
Mm-hmm.
these specialists can offer cash prices or membership prices. So,
I
one of
see.
those apps, for example, is also based here in San Antonio. They're called Lasso, LASO. So, you can find it
Mm-hmm.
on the App Store, and
Mm-hmm.
you can just go on there and look for whatever specialty you want to find on a cash basis and have access to that.
Oh,
The
nice.
other thing that to answer your question, there
Mm-hmm.
are insurance brokers who recognize that this is a very viable method
Mm-hmm.
to give
Yep.
healthcare to a lot of people, and
Yep.
they have crafted solutions around the direct primary care offering, and
Mm-hmm.
direct primary care being the membership based model. So, whatever is not part of the 80%, they
Mm-hmm.
say, hey, well, let's get you set up with either a healthcare cost sharing
Mm-hmm.
organization
Yep.
or even with a traditional insurance product to take care of these high ticket items and of
Yep.
these catastrophic items. Because let me make one thing very clear. Health insurance, I'm not demonizing that at all. I think it has certainly a place in the ecosystem and in a person's health protection, but it needs to be utilized in the right way. And one
Mm-hmm.
way to see it is when you make an analogy with your car.
Yeah.
You wouldn't use your car insurance to get your fluids filled up, right, for the windshield wipers, for example.
Mm-hmm.
You would use your car insurance when you get into a bad accident. However, in healthcare, we somehow have this tendency to think,
Mm-hmm.
well, for anything, a small checkup or my regular contact with the doctor, I always need to invoke insurance, and that is part of the problem because that makes it expensive.
Well, I think in terms of you touched on the deductibles and the high ticket items. So one problem with the ACA, the Affordable Care Act, is that the assumption is that a lot of healthy people will enroll, and you will have a large pool of people under that insurance, that even the heavy utilizers of insurance will still have coverage. Excuse me.
Yes,
So that
exactly.
goes for the same. So, excuse me. In terms of getting breaks, that's where the deductibles come in to kind of try to regulate usage of insurance. So, I'm not saying it's pro or against, but it's more like a mechanism to regulate the utilization of insurance. But I agree that we should focus more on preventive medicine as compared to intervention medicine because it costs way more.
Absolutely. And that's the whole idea, the whole premise of having a medical membership where you basically lower the barrier of access to the doctor, especially if you are an employer and you want to keep your workforce healthy. You want to fight absenteeism and you want your person with a chronic ailment, you want them to take care of themselves. Then this is a really, really good solution.
That's awesome. That's great.
Nadia, I think you have, I forget, you have another commitment
Yeah,
very soon coming up.
yeah.
Yeah. So
Mm-hmm.
it's time to wrap this up very
Sure,
soon,
yeah,
but let me
yeah.
go through the comments here, see if we have any
Sure. Do you have
questions.
any questions? Yeah, that would be great.
Okay, what do we have here? Mostly affirmations, no questions. People just agreeing
Thank
with
you.
what we're saying.
Mm-hmm.
Let's see, we have uh, Aziza Alawi, who agrees with us. Mental health has definitely effects to the physical health. Yeah, that's something we spoke about. And then, yeah, just Andrea Ferguson also here uh, affirming that there are different healthcare solutions. And
Yeah.
yeah, I
Before,
think.
yeah, before we wrap up, also, yeah, we talked about the problem of like, where are we going next? Like, I wanted to touch base on that. Now we know, we acknowledge the problem is there. It affects millions and millions of people. So, what are the efforts to reduce that disparity?
Mhm.
I think there is a lot of um, legislative efforts to expand access to enrollment and have coverage through the ACA again. And in terms of COVID response, there is a lot of focus on the inequity. So whenever there is distribution, whether it's testing or vaccines and so on, that inequity is front and center in those efforts. And maternal health is a big one too, especially in people of color and minorities. They have higher infant deaths, higher deaths from maternal related issues. So there is a new initiative that was approved recently by the Center of Medicaid Services, which is a waiver for many states to extend Medicaid postpartum coverage. So instead of that, depending on whether it's a regular delivery or a C-section, to expand that coverage beyond what existed before. So I hope that will help at least decrease that disparity within the maternal health medicine.
Yeah, there is hope. There are a lot of people who want to make a positive change, and I think both you and I are part of that solution. Another thing that I haven't really mentioned, but I think it is worth mentioning, is that if you keep yourself healthy, then you probably will never have to get to utilizing healthcare solutions. That would be ideal in the first place. I am myself a huge proponent of a healthy lifestyle. I have chosen for myself, not to say that that is the only way, but I have chosen for myself a vegan lifestyle, and that has helped so much with inflammation that I had to fight with. But then, of course, there's also taking time to go to the gym, taking time for yoga or whatever is good for your mental health. And I just want to plant the idea into our viewers' minds that by taking care of their healthcare and by taking care of their mental health and their overall well
Mhm.
being, each time they do that, they really put a coin in a piggy bank. Because
Mhm.
what happens is that if you keep yourself healthy, you cannot imagine
Mhm.
how much primary and secondary cost you avoid in the future. It
Yep.
is just incredible. You
Yeah.
don't have the high prices for the medication because you don't need it. You don't
Yeah.
have to pay for surgery or whatever.
If
You
I
don't.
may
It's just incredible.
if I may add, on top of the individual's,
Mhm.
decisions that one makes, there was this study that looked into centenarians, the people that live to 100 years. So
Mhm.
this person went all the way to Italy thinking that it's food, they have a healthy lifestyle, it's exercising and so on. What they found out is that it's the community, the strong community relationships. If somebody is older and they don't show up to the next door grocery store or to grab their milk, their neighbors will be asking about them. Their grandchildren are two doors down. So that brings like the mental health slash community aspect into our overall health.
Yeah, that makes sense, and that might be an encouragement here right now for these times where we all hunker down in our homes, and we might not even think about, well, how is this person doing, because we're not in a situation where we are in places where they typically appear. So maybe if you know of people who are elderly or weak or frail, reach out to your network, reach out to the
Mhm.
people you know, and check on
Yeah,
them. That
yeah.
is really, very interesting that that has such a high impact. I wouldn't have thought that.
Mhm. Awesome. It's been really a pleasure. That was fun having
Yeah,
this
that was
discussion with
fun.
you. Yeah.
Yeah. Okay, well, again, last call here. I'm gonna blend in your LinkedIn profile one last time. If you want to leverage Nadia's vast knowledge in healthcare, business acumen, technology, please reach out to her. And for myself, if you want to know more about the free market movement in healthcare, reach out to myself or go to the website. And also, if you happen to be in need for healthcare marketing services, I do offer that as well. Thank you for having been with us today. It was a pleasure. And if you see the recording, there's still time at that point to leave comments. We're going to come back to it and make sure to take care of all your requests. Thank you so
Awesome.
much.
Thank you,
Bye for
Shankar.
now.
Bye.